Have you ever had a patient say no to periodontal therapy, like at a time when you recommended an increased frequency of continuing care appointments or coming back for more periodontal therapy treatment because their insurance won't cover it? This is the most common frustration in most dental offices. So many doctors and dental hygienists complain about this issue and don't know how to overcome this. In fact, many of the dentists and hygienists I have spoken to actually have given up and now have someone in their office that routinely checks their patient's insurance coverage in order to help maximize the benefits. The biggest problem becomes that by doing so, you ultimately allow the insurance company to dictate the treatment recommended, whether you like it or not. What I often see in dental offices across the country is one common theme. The patient claims they can only do what their insurance will cover because they can't afford any out-of-pocket expenses. The well-intentioned hygienist sympathizes with his or her patient and ends up not recommending the right treatment or alters the needed treatment in a way that reduces the effectiveness of it. By the time the dentist comes in to do the checkup and present treatment, both the patient and the hygienist are fully convinced that this patient in no way can afford to do anything above and beyond their insurance coverage. Well, that treatment presentation would be like swimming upstream, difficult and exhausting and likely a failure. In order to move forward and have some impact with your patients, you not only have to have your key case presentation skills in excellent shape, so check out our Ultimate Case Presentation program for more on this topic. But more importantly, your team has to be fully engaged in the solution to the disease they're there to heal to begin with. Your team is your biggest ally or your biggest antagonist, depending on what they believe in their core. Helping your team appreciate and understand that money is not an objection and rather it is used as such because the person doesn't understand the importance and urgency of their disease is key to the solution in getting your patients to accept their recommended treatment. I often do this workshop with dentists and their teams because it's a simple and fun way of shifting new team members when it comes to their beliefs about money. This workshop focuses on their own spending patterns and forces each team member to look in the mirror with respect to how they use money. Once they realize just how much they spend on frivolous and unnecessary things, they can appreciate how little we're asking our patients to spend on healing their periodontal disease and accept recommended treatment.